Good morning, Metro managers. Thank you all for coming. Today we are going to go over employment-related law. The purpose of this presentation today is to provide you all with working knowledge of employment laws. We will discuss the Civil Rights Act, the Americans with Disabilities Act, the Occupational Safety and Health Act, the Fair Labor Standards Act, the Equal Pay Act, the National Labor Relations Act, and the Workers Adjustment and Retraining Act. There are other laws that you should be aware of, such as FMLA, workers' compensation, and veterans' preference, but for today's presentation we will focus on the 7 laws on the left. In discussing these laws, we will use an example of how a violation may present itself in a way that you would see here at Metro Medical Center. We want to avoid all possible violations and will discuss expectations as well as ways that you will be able to protect yourselves and our hospital against potential legal action. First off, we have the Civil Rights Act. This act was put into action to outlaw discrimination based on race, religion, sex, and national origin. The Equal Employment Opportunity Commission, or the EEOC, was created to legally help those who have been discriminated against in the workplace. An example of discrimination in our facility could be if a nursing manager favors her female employees and denies her only male employee a promotion because of his gender. This is a civil rights violation. Here at Metro Medical Center, we want to encourage our staff members to be mindful and respectful of all of our coworkers and patients. We hope that everyone treats others in a way that they themselves would want to be treated, regardless of their race, religion, sex, or national origin. We expect our managers to ensure that there is no discrimination happening among coworkers, from managers themselves or towards the patients we treat. We expect the managers at our hospital to have an open-door policy for their employees so they feel free to bring any concerns that they may have regarding discrimination or unfair treatment in the workplace to a manager. This will also not be held against the employee bringing the complaint to your attention. They will not be retaliated against in any way. We ask that you take these few steps to protect our employees and make sure that our hospital is a welcoming and tolerant place to work and receive care. Promote a positive work environment and encourage being respectful to all coworkers. Provide education about the types of discrimination and how it may show itself in our workplace. Provide inclusivity and cultural sensitivity training. This type of training can help shed light on discriminatory ways. It can also show how certain words and actions can be hurtful. If there is a matter with discrimination, as a manager, you will need to deal with complaints in a confidential way and do so promptly. Do not dismiss these claims. Take them all seriously. It is also good practice to document all actions taken with employees. It is important to have documentation if an issue cannot be simply resolved. The Human Resources Department can help you with these matters. The Americans with Disabilities Act, or the ADA, prohibits discrimination based on disabilities and gives equal opportunity for employment and benefits to those with disabilities. If an employee with a disability qualifies, you must provide reasonable accommodations for them to perform their job. An example of how we may see an ADA violation here at Metro Medical Center is if we have an X-ray tech who suffers from Crohn's disease and we do not provide that tech with enough opportunities for breaks and use of the restroom. Here at our medical facility, we expect our managers and staff members to never discriminate against someone with a disability. We also want you all to remember that not all disabilities are visible. Disabilities can range from anxiety, depression, epilepsy and diabetes, to blindness or the loss of a limb. Managers should never assume someone with a disability cannot do their job. If a reasonable accommodation can be made, then we expect our managers to give that opportunity to the eligible employee. Managers should also have open lines of communication with their employees. Hear what the disabled employee needs and work with the employee relations team in human resources to help the employee be successful at what they were hired to do. To avoid any violations with the ADA, we would like to see our managers and staff go through proper training on how to respond to ADA complaints and how to create accommodations that are suitable to the employee for job performance. Staff will also be trained on the proper way to interact and assist people with disabilities. Managers will be responsible for making sure their work areas are ADA compliant and accessible. Managers will also work with the disabled employee and HR to come up with a reasonable accommodation plan. Metro Medical Center will not tolerate any discrimination against someone with a disability. The Occupational Safety and Health Act was put into law to reduce workplace hazards and implement safety and health programs for employees and employers. OSHA, the Occupational Safety and Health Administration, was created to enforce safe workplace practices. This law and organization hold us accountable for providing our employees with a safe work environment. An example of how we would see an OSHA violation at Metro Medical Center is if our staff were not disposing of needles correctly. If used needles were left lying around, this could result in an accidental stick and could spread infectious diseases to our staff members or even other patients. This would be a clear OSHA violation and would result in substantial fines. Some of the ways we expect you as managers to be aware of OSHA issues are to please follow OSHA's provided standards for health and safety in your workplace. Have open communication with your employees about any concerns they have with anything that could be potentially harmful. We do have an OSHA safety team here at our hospital, and we ask you to use them as a resource for any questions. Also, work with them when it comes to in-house inspections. They are not the bad guys, they are a part of our team. We also expect you to take your employees' safety very seriously. Do not put them in unsafe situations. We also ask that you are taking care of your equipment, maintaining any required maintenance logs, and removing faulty or broken items. There are a few steps you can take in protecting our hospital from any OSHA violations. Again, follow the OSHA standards. When an OSHA inspection occurs, this is their guide for how we should be safely conducting our daily operations. Make sure that putting safety first is a priority. Work with our in-house safety team and provide training to your employees on hazardous materials, workplace safety issues, and how and where to display OSHA posters in the work areas. Also, please allow your employees to feel free to report any OSHA-related issues to you. You can allow them to do so anonymously, and those employees should never be retaliated against for trying to make our workplace safe for all. Keep your records up to date and detailed. You should be documenting anything that is a safety issue and working with our in-house team to conduct tests or precautions if needed. And lastly, another way to avoid violations is to follow proper OSHA protocol in reporting a workplace incident if one were to happen. There are certain timelines you have to report incidents to OSHA so they can conduct their investigations. Next, we have the Fair Labor Standards Act. FLSA establishes the standards for minimum wage, overtime pay, record keeping, and youth employment. Since Metro Medical Center resides in North Carolina, the minimum wage for our state is $7.25 an hour. The FLSA also lays out the rules for overtime. If you have a non-exempt employee, someone who is entitled to overtime, they will earn 1.5 times their pay for any hours worked over 40 in a work week. An exempt employee is someone not eligible for overtime. Another aspect of the FLSA is child labor laws. A 14 and 15-year-old can work, but there are many limitations to their hours per week. They can work 3 hours on a school day, 8 hours on a non-school day, and their hours must be worked between 7 a.m. and 7 p.m. A 16-year-old employee has no FLSA limitations. A workplace example of an FLSA violation is if you asked an employee to work overtime, then after they did, you tried to compensate them in a way different than paying them the time and a half of their wage. This is a violation of FLSA. They are entitled to that overtime pay. We expect you to maintain correct employee timesheets and attendance records. Clear records will allow you to manage your employees' pay. Pay your employees for the time they work. Do not cut side deals. If they work overtime and are non-exempt, they are to receive time and a half for that overtime. Be very clear about your employees' job duties. Make sure they are on the same page as you when it comes to their hours and type of employment. You should display an FLSA poster in the work area or break room. This is a way to protect yourself against any FLSA violations. Other ways include keeping accurate records, verifying employee classifications, and adhering to the law with an employee under the age of 16. The Equal Pay Act. This act prohibits gender-based wage discrimination. For example, if a male employee is earning more money for performing the same job as a female employee, and they both have the same seniority and skill sets, this is a violation of the Equal Pay Act. Human Resources will be the one who initially assigns a salary to a new employee, but as a manager, you have the ability to promote and provide raises to your employees. We expect you to be aware of the wages and benefits you are changing for your employees and why. Be fair. Do not base those decisions on an employee's race or gender. Please contact Human Resources if you have any questions about wages for your employees. Also, we are not saying that every employee has to be paid exactly the same. There will be times when wages are different due to seniority, merit, and quality and quantity-based work efforts. Ways to protect against equal pay violations is to understand the law itself. Familiarize yourself with the law and rules and not discriminate. When determining a pay rate, one rule of thumb is to pay for the job being done and not the person performing the job. Also, we ask that you hold timely employee evaluations and communicate very clearly what performance issues an employee may have or what expectations they are or are not meeting. This will give the employee an idea of where they stand. They will be aware and know they are not meeting expectations when a coworker may be awarded a promotion over them. As always, clearly document your reasoning for your assigning of an employee's wages. This will shed light on your decision if a complaint is ever brought against you. The National Labor Relations Act was put into place to allow employees to unionize and participate in protected activities for the betterment of their working conditions. This act was in favor of the unions, and our government thought their power needed to be balanced. The Taft-Hartley Act was used to give some of that power back to the employers. There are now restrictions on how unions conduct themselves in regards to striking, boycotting, and memberships. Basically, anyone has the choice to join or not join a union. That decision cannot be held against them in any way. Unions are also not allowed to strike without providing notice, hold secondary boycotts, or make every employee become a member. This is how we expect our managers to treat unions in the workplace. An example of an NLRA violation would be if a manager was restricting workers from discussing union ideas during the workers' lunch breaks. This is not a time that they are actively working, and those employees are allowed to be involved in union matters. However, you can stop employees from participating in union activities while they are on the clock or using our office supplies to create union materials. The ways that you can protect our facility from any NLRA violations would be to allow your employees to choose whether they want to be a member of a union. If they choose to be a part of a union, you will in no way spy on them, threaten them, interrogate them, or retaliate against them due to their union ties or agenda. To finish out our employee law presentation, we will touch on WARN. The Worker Adjustment and Retraining Act is used to protect employees from not having time to adjust to an organization's closure or a mass layoff. This allows employees time to receive training in a new area or learn a new skill so they can find new employment. As an organization, we would have to give our employees 60 days notice of any closure or layoff. This workplace example is if we were closing our doors due to a lack of patients and decreasing population. We would have to notify every employee 60 days before the closure would take place. If we did not provide this notice, we would be in violation of WARN. We expect you to have an open communication with your employees and just be sensitive to what they are going through. We hope that we never have to give this type of information to any of our employees, but if need be, we must understand the emotions and stress that comes with mass job loss. To protect against WARN violation, a 60-day notice will be given in the event of a closure or mass layoff. Thank you all for coming today. Please remember that Human Resources is here for any questions or concerns you may have. Thank you for listening, and we hope that you take this information back to your departments and that it helps make Metro Medical Center a wonderful place for people to work. Have a great day.